Welcome to Wealthing Talks. I am your host, Alicia Castillo Holley, bringing you real life conversations from Silicon Valley or somewhere around the world. We will talk about disruptors, angel investments, venture capital, and of course, family offices. Join me along with my children, their families, friends, disruptors, and investors as we explore the fascinating world of creating wealth in a completely different and authentic way. Hello, everyone. So happy to be here in 2026. This is the first episode that we record on the 2026. Mila, thank you so much for being here. It is such an honor to have you here sharing your experience with us.
Hi, thank you so much for inviting me, and I'm so honored to be at the podcast on the first podcast of the new year.
Yeah, this is going to be an interesting year for you. Mila, let me just start with a question. What are you doing now, and how did you get to be here? Because you have a very unusual trajectory.
Yeah, my background is absolutely unconventional for someone who supports longevity science and supports biotech. And because I started as a historian of culture, so I have master's degree in the history of culture and arts, and then I transitioned into journalism, and I worked as a journalist for many years. And in the last years of my career, I was writing about business and economics. And in fact, I was interested in business and economics for all of my life. Um, my father encouraged me to study economics because he's an economist himself. And maybe this made me interested in investing little by little. And it was my dream for all my life to be able to do something meaningful because not just making money, but doing something for the future of humanity and support important things that are future forward. And just a few years ago, I've been going through a very difficult and dramatic period of my life after a long time in being married and being a housewife. I decided to get divorced. It was a very bold decision because I didn't have any job, or I didn't have my being a housewife and a wife was my main role in life for a long period of time since we moved to the United States, right? And during this journey, I suddenly realized that okay, I've lost my status, I've lost my social status, and I don't know who I am. And the search of meaning became number one idea in my life. It became number one goal in my life. And all the main things that I've been thinking about for many years, they became like gradually became more and more important to me. And I realized that, okay, what do I want to do today to make my life meaningful? What do I want to do for the future of my children, for the future generations? So I ask myself essential questions that some people may not ask in their lives. And I realized, okay, I want to invest. I wanna support. I didn't quite know what my thesis will be, but I knew that I want to do something very impactful. And I took a course on investing at Stanford. And my professor, my instructor who taught the course, was a venture capitalist and a scientist. Ronjan Nag, and he introduced um, his venture fund and longevity companies that he created or co-created, co-founded, and many other companies. And I was able to see the entire ecosystem. And my classmates also introduced me to you, Alicia, and I was able to join your venture club.
Who introduced us?
Yeah, Terry Hansen had actually
Oh, Terry introduced us. Oh my
introduced
God.
us, and I am forever grateful to her for that because it changed my life.
She's such a
Okay,
wonderful person.
and so little by little, I realized that okay, my I want to focus on biotech because um, I have no knowledge in AI.
Hmm.
I don't have any knowledge in tech. So by the method of exclusion of what's not my expertise, I realized, okay, I've been interested in healthcare for a long time. Um, that there was a long period of time in my life when I've been a skincare maker. And that's a separate story. I will tell you maybe later. Okay, but my brand, my small brand of skincare, it was focused on skincare ingredient safety. And I spent a lot of time reading like clinical papers on the ingredients. I spent a lot of time researching the ingredients, and that brought me to like the that made me interested in biotechnology and made me interested in healthcare. So eventually, eventually, um, I've realized that I want to support the companies that help improve our healthcare system. And that decision, it wasn't just because of the social awareness and because of seeing the healthcare crisis that
Hmm.
yeah experience, and it was because of my personal journey, because I had a few episodes in the past in my family and in my own experience that made me think deeply about the fragility of our life and the fragility of our body and um, the how it affects I don't know, our existence,
Hmm.
right? So the first episode, the first experience that I had of that kind, it was very tragic because when I was younger, when I was in my 20s, my mom got sick and she had a rare neurodegenerative disease, which is called peak disease. It's a variation of the Alzheimer's, but it usually happens in women. It's it happens early in life, or when it starts maybe when women are in their 40s or 50s. And the problem that it's nearly impossible to detect early, like
Wow.
and diagnose. And the symptoms, they remind a bunch of other conditions, and they may not say anything.
Hmm.
So it's like maybe some sleep issues, maybe some kind of depressions or memory loss, like, and um, and by the time when we were able to see that something is wrong with her, it was too late to intervene. And by the time, it was very difficult to diagnose her because the disease was very rare. And even experienced psychiatrists, they weren't able to like understand what's going on. And I remember the day when I saw her MRI, and I remember the feeling that I had, and it was absolutely heartbreaking to understand that the disease is irreversible and the drugs that are available to her are only they can only slow down the
Mhm.
progress. But basically, her cognitive skills were already at the level of a 3-year-old child, right? And it was absolutely devastating for my family. Things that we've been through, I can't describe, and it's impossible to describe in words because it's not just the pain that you see in your loved one, but it's also like social disconnect because people around you, they don't understand what you're going through, and it's
Mhm.
impossible to explain, right? And yes, it put a huge toll on my mental health, on my life. And even though my life was generally very good and prosperous, right? This was a major loss. And eventually, it so happened that my mom left our home. We weren't able to supervise her 24/7. And it so happened that she's left home and she has never been found. We were looking for her for many years and we haven't found her. And that situation, it made me reconsider all my life and made me deeply aware of how fragile our body is, how fragile our social status is, and how superficial all our achievements may be. Because my mom, she was a really brilliant person. She was really talented. She was very kind. She helped many people, but nothing helped her, right? And it put me in a deep search mode because I was searching for a mission, but I couldn't find for many years. And whatever I did, nothing satisfied me at
Mhm.
all. And from that perspective, you probably understand
Mhm.
why it was so important for me to become someone who helps people at scale, like
Mhm.
uh, supporting uh, the research that might alleviate the diseases, might alleviate pain and suffering in people, and make the future of humanity better than it is now. But there was another experience. I had near-death experience when I was giving birth to my older son, and also lack of supervision.
Mhm.
The clinic was understaffed. It was like a regular clinic, nothing fancy, and the nurses were absent for a while, and I had a preeclampsia, right?
Wow.
And the fact that I'm alive is a pure chance and luck. It's not something that someone really helped me, but it's lack of supervision. It's something that I would like to change.
Mm.
Maybe, okay, I won't be able to change it in my country, in my healthcare system, but maybe somehow I'll be able to change the outcomes for the patients worldwide. And basically, yeah, one of the companies I invested in, it's the company that measures biomarkers and ISF, and the sensor combines physical and chemical sensing. Uh, uh, and it has a huge potential combined with AI for early detection of many dangerous conditions. So, yeah,
Wow. What a journey.
yeah, I've been through difficult things, and like uh, I at the same time, it was very important for me to study. It was very important for me to um, to eventually make some impact in this world. And as a result of all these things,
Yes.
I basically became someone who I think comes from the place of compassion in investing. So I may not be a quantitative person. Um, I may not understand the scientific part, but from my knowledge and experience, I okay, I understand. As an investor, I have my own methodology, but
Yeah.
that's a different story, right? But the main message that I want to convey is that if we want to change this world fundamentally, this is not just about technology. This is about the way we treat each other,
Hmm.
about compassion and kindness, essentially, right? And this this is very important in the in patient care
Yeah. Yeah.
as well, right?
We rarely hear an investor talk about compassion. Very rarely. But
Okay.
but I think it is important to talk about that, not just in healthcare, but founders have a very difficult time managing their startups or their early growth. And it is
Yeah,
great to have an investor that is kind and compassionate. Or sometimes people say, oh, you're a cheerleader investor. Yes, I am, because I know how hard it is to start a company. So I think we
that
all
was
need that.
yeah, that was very important for me when I joined Wealthing. It was really important for me to see you as a role model of someone who supports companies beyond investing and who supports not just the company but the ecosystem.
Mhm.
And this is social awareness. So here's the thing: when I was a journalist and I interviewed the founders, I tried to develop like some kind of framework to see what makes them so successful. It was like my personal research. And I figured out that, of course, resilience is important, but what's also important is social awareness. And social awareness is something, the ability to see the ecosystem and even this society from the perspective of the future, maybe even. And it's a rare ability that it may be trained, it may be cultivated, but most talented founders and investors, they have it uh, at the intuitive level. And that it's essential about investing that the investors and the founders, they collaborate.
Mhm.
They create this kind of balance between each other. And it's not just about, giving money to someone and multiplying, receiving some multiples,
Yeah.
right? It's um, it's a collaborative, deeply collaborative process. And it was important for me when I found my companies, when I found my founders. It was very important for me to support them as much as I can. I'm not a scientist. I'm not a big venture capitalist who can give them, write a million checks, right? But I can write, I can tell the world about them, I can promote what they do in many various ways. I can help them receive non-dilutive funding.
Yeah.
I can make connections and intros which I do on a almost on a daily basis. I connect people with each other and I see the results, and this is fascinating. Yeah.
That's fantastic. Did you ever think you would be in Silicon Valley investing when you were young?
I never thought about it. I never thought about it
Me
that,
neither.
and I Okay, you come from Venezuela, and I
Mhm.
come from the Soviet Union. So
Yeah.
when I was a kid, I remember the last years of, the Soviet Empire collapsing and the economy, and nobody taught me business, right? Nobody taught me. Um, it was
Yeah,
okay.
me too. We never talk about, at least your dad was an
Okay.
economist. My
Yeah.
dad was a scientist. He was a rice
Okay.
and bird expert, and he talked about cells. And in my home, the assumption was that only stupid people got into commerce because they were not
Okay.
smart enough to do smart things, so they had to
Okay.
go and sell things.
That's very
So
familiar,
yeah, that and yeah, and it was just a huge learning for me.
but
And I'm
it's
very
not.
grateful.
Yeah.
I'm very
Sorry, I
grateful.
interrupted you. Yeah.
No, no, I'm very grateful to many people said that's not the way it works. And I'm like, what? No.
Oh,
And so
yeah. I
yeah.
remember myself coming to my mom when I was around maybe 13 years old.
Mhm.
And I came to her and I said, Mom, can I have a business of my own? And she looked at me funny and she made big eyes and said, That's risky. And her eyes sparkled. And I immediately understood that this is something I want to try.
Well,
And when
I remember,
okay.
it's people, yeah, it's just if you live from different countries and different socioeconomic models. I remember that I was working very, very hard, and I was at a lab once, and I called my sister, who is a model, uh, and she's 1 year and 1 day younger than me. And I called her up and said, "Hey, I'm in the city. Do you want to have lunch?" So we go and have lunch,
Mhm.
and we start talking, and she says, maybe do you want to buy some shoes or something? And I said, okay. So we went, and the shoes that she wanted to buy were more than a month's salary for me. I was a professor.
Okay.
I spoke several languages. I had several degrees at that time. She had studied ballet, but she was very, very pretty and very smart, very nice person, very kind too. And she said, why don't you buy that? And I said, no, I can't afford that. And she said, don't be so cheap. And I said, that's more than a month's salary for me.
Okay.
And she looked at me and she said, why do you do this to yourself? You're smart. And that was the realization. She said, I am smart. That's why I'm
Okay.
a professor. And she says, no, 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 you got it all wrong. And I thought it was hilarious. And she was
Yeah,
shocked. She said,
that is
I
hilarious.
made, yeah, she said, I made that in a photograph. How much my dad was a professor. How much does he make? I said, very little too. But it's just a
Crazy.
different, yeah, it's a
Yeah.
different thing. And I think it's really interesting to how life moves us around and gets us to a place. And I don't know what's going to be my future, but I'm very happy to be doing what I do. Um, and I think I listened to your conversation and your journey and said, oh my gosh, how how did you get here, and how did you get to the realization that your life or your purpose is to support founders in life, and you're becoming one of the experts in longevity. And I think not being a scientist, not having the scientist training gives you a lot of advantages, because you don't have the gringolas, as we say in Spanish. You don't have the frame that this is the way life works. You're open to the world, and that is something I really appreciate.
Thank you, Alicia. Actually, the most advanced scientists I see, they have that beginner mindset. They have the mindset where not knowing is the key, like,
Yeah.
thing, because otherwise they won't be able to explore and they won't be able to discover new things.
Yeah, so one of the rules of scientific research is skepticism, and that most people don't understand that the role of science is to prove that you're wrong, not to prove that you're right.
Prove
So
yourself wrong.
yes, that's what we do all the time. So we get excited. We're like, oh, I was wrong. Now you can imagine how that works in the commercial world. And
Yeah.
and the challenges that AI brings now, because AI is all about proving that you're right. It's never
Mhm.
proving that you're wrong.
Yeah.
So I think we're getting into a very interesting era of research and development. Um,
Yeah.
yeah, I think that's gonna. What do you think is gonna happen with with what you've learned about longevity and research and AI?
Oh, it's very exciting, actually. So I, so when I started investing in longevity, I didn't know how to pronounce longevity. I was confused. You know, I asked the scientists I invest in, how do I pronounce longevity? Okay,
This is
so
me with entrepreneurship. I didn't know how to pronounce entrepreneurship, how to
okay,
spell it.
yeah, but you don't know how to pronounce, but you do it, right?
Yeah, well, I didn't know I was doing it. Yeah.
So, so 2 years ago, I kept hearing from the key opinion leaders and people who invest in longevity that the inflection point is near, which means that all the like sporadic research, all the things get together, and the capital flow becomes more uh, consistent and intense, and the industry becomes more visible. And over the course of 2 years, I keep seeing a lot of important developments,
Mhm.
especially during 2025, which is absolutely incredible given the situation, the unfavorable situation for life sciences during 2025, right?
Yeah.
And in the longevity field, um, it's probably the fact that GLP-1 drugs became more than obesity treatments because the, the, they were proven to be beneficial for cardiovascular health, right?
Mhm.
And maybe the invention of the FDA approval of the first mitochondrial treatment as
Mm.
well. And I would say the inflection point is here. It's not near, it's here.
It's here.
And I would expect, as a historian, my perspective as a historian, not as a quantitative person, my forecast that in the next decade there will be a number of significant discoveries in the field that will change the way we view our life and change the way
Yeah.
we view our society, even. And these are for the current state we're in and for our mindset. It's something that we can't even foresee or predict
Yeah.
because it's like aviation. Aviation, when Tsiolkovsky, the Russian scientist, came to the Russian Scientific Society in, I guess, 1906 or 1905, and he asked the money for the first Zeppelin, they
Mhm.
said, objects heavier than air cannot fly, period.
Mhm.
They sent him away. So people do not realize how life will change. And there are a few like very important like fields like mitochondrial treatments,
Yeah.
like epigenetic reprogramming, genome editing, and anti-senescence, and a number of others that are near or in the clinical trials right now.
Mhm.
And in the next couple of decades, it may happen, it may, we may see that, okay, we may be able to extend our lifespan for maybe a couple of centuries, right?
Yeah, yeah. No, we see that. I mean, we've invested in a couple of companies that do that. And genetic expression was my
Yes,
field.
yes,
And I was talking to, sorry to interrupt, but this is my
absolutely,
field. I get so excited about this.
absolutely.
And we didn't know anything. I was working on that 45 years ago. We had no clue. This is like blind slicing genes, cutting, adding to bacteria so they can transport to another genome. And and now we know much more. But there's also treatments when you get injected stem cells from the umbilical cord from somebody else. And I was talking to a young person who wanted to understand a little bit more about the treatment. And I'm not endorsing the treatment, but I did refer to him that if you're having several of these treatments, you're adding somebody else's DNA into your DNA, into
Hmm.
your bloodstream. It's going to impact your cells as they reproduce, and we don't know the impact of that. And I think the way genetics and health or bio research is evolving, we're going to advance, like you said, dramatically. But then we need to think about the social changes because I
Yes.
can't, I'm 64. I don't want to retire, uh, but ever. I think I'm going to die. I don't consider this working, but I don't want to retire. I'm just too active. But if somebody is going to work 20 or 30 years and then they're going to live 50 years, as a society, we need to figure out how to run that. And that's something biology is going to define, is not going to be able to define. Society has to define.
Society has to define, and
Yeah.
ethical questions come front and center,
Yeah.
right?
Yeah.
And also, it's not just about social, okay, it's about social relationships largely. And I ask myself, okay, um, what kind of society it may be if I'm gonna live for 200 years or 300 years, or like in biblical times, they lived for 500 years. What do I want to see in this society? What do I want to change in this society to be able to want to stay for longer? Because right now, uh,
Oh, that's
there's
true.
a different aspect to it. Yeah, right now I'm almost 50 years old, right? And I am pretty tired of this society because I keep seeing a lot of pain and suffering around me. And even though I'm a, resilient person and I've been through a lot, sometimes it makes me cry. I'll be honest with you. Sometimes I just cry when I see other people suffering,
Yeah.
right?
Yeah.
And sometimes you don't know how to change it. And sometimes one person is not enough to change it. And I just, I don't know, from that standpoint, um, uh, it also, when you live for longer than 100 years, um, all that you've done stays with you, and all your
That,
reputation.
that was going to be my last question, but
Okay.
those, I learned so much in the podcast because I never thought about that. But you're absolutely right. When you live longer, your history stays with you
Yeah. It's
longer.
not it's not just build something that outlives you and stay. It's
That-
build something that you will be comfortable staying with for the rest next couple of 100 years.
So you just, I'm going to send this to a couple of our members too, and friends of mine that are working on what is it, date of death, and they're preparing their families, their lives, their inheritance for that. But now we have to rethink about that. But you almost ruined my last question, which is the question I love to ask, because because I was dead when I was 13. And I always think, who am I when I'm not here? What is my essence? So I could see myself, I could float and see myself. And I'm like, oh, shoot,
Oh,
I
really?
died. I did.
No,
Yeah,
please
I did.
tell me.
No, well, I say in the podcast, I fell off a horse, broke my appendix. I
Oh
didn't
my
want to tell
God.
anybody because we stole the horse with my cousins
Okay.
who were troublemakers in the city. I come from a town. So it was very complicated. But I remember watching me dead, and I was
Oh my
like,
God.
"Oh, I died." It's sad, incredibly sad, because I was only 12 or 13. But then suddenly I woke up, and
Mm,
actually I know why I woke up. I woke up because the nurse made a mistake and punctured one of my veins, and the pain woke me up. So pain sometimes is good,
that's
but
crazy.
but the thing is, I became extremely spiritual. And I realized, so when you see death so close, you realize that you are going to die. So we just
Yes.
talked about longevity, but at some
Yes.
point, you're not here. And
Yeah.
I think part of the reason why I want to do this podcast is I lost so many of my dear friends, especially scientists, and I never had a chance to share with the world who they were. to share them with the world. So we're not going to be here. And actually, most of the people that are listening are not going to be able to connect with you in person, in real time, in time and space. They're somewhere else. And then my question is, when you're not here in time and space, who are you? Have you thought about what is your essence?
My essence? That's an interesting question. My essence is love.
Your essence is love.
Yes.
So that's who Mila is.
Positive. Yes.
Yeah, that's fantastic. So with this, we're going to end the conversation. Mila, so grateful and so much fun to have you in our podcast. Thank you so very much. If people want to reach out to you, how do they contact you?
Maybe on LinkedIn. Alicia, I want to thank you so much for inspiring me, for being a role model, not just for me, but so many people.
This is for you. This is about you. This is not about me.
Yeah, but this is about both, I guess, because this is something very collaborative, and my journey was largely inspired by you. Thank you.
Thank you so much. So isn't this delightful? Mila is a typical example of somebody that came here around, moved around, very, very eclectic background. And being here in Silicon Valley, when you're bombarded with technology, innovation, progress, it's very, very exciting. But she has something that is very unique. That is her humanity. I hope you enjoyed the conversation, and I'll see you in the next episode. Yours in Wealthing. Thanks for tuning in to our Wealthing Talks. I hope you've enjoyed this conversation. To stay connected, visit us at wealthing.com. This is Alicia Castillo Holley, your host, and until next time, yours in Wealthing.